Hi everyone. Today I am here with another video discussing a case note. What to write in a referral letter. We are going to discuss a case note thoroughly, and we are making you understand what to write in a referral letter, how to write, and what are the things you must avoid when you write, what are the things you must be taking care when you write a referral letter. So let's watch and learn how to write a referral letter. When you get a case note to write, these questions which is displayed must be there in your mind. For the first one, to whom am I writing? What is the purpose and reason for writing the letter? What information do they need to know? What information do they not need to know? What is the current condition? So these are the questions you are going to answer through your letter. Really, you must clearly understand the purpose whenever you write. Actually, that is being assessed in your letter. And to whom you need to write. According to him, you should organize your data, and purpose must be easily understood by the reader. So what information do they need to understand? So what is the plan they should, what is the plan you are writing, and they have to carry out that plan. The information which they suppose not to know, please don't write the information they do not need to know. And what is the present condition of the patient? So all sum total of these questions answer would be your letter. So this is a case note which we are going to discuss today. In this case note, you are Daniel Nicola, a qualified nursing sister working in Apollo Hospital, and Catherine Tracy is your patient here. Okay, you can see this, everything is displayed over here, like name Catherine Tracy, address is displayed here, and date of birth is displayed, and social background also is given. As this is a full case note you are getting regarding Miss Catherine Tracy. Catherine Tracy was admitted in the hospital due to some serious injury to backbone, and spinal cord injury is revealed after the examination, and she was with loss of movement, bowel and bladder control, difficult with balance and walking. And these are the case note which we get, and we understand from the case note these are the problems that when she was admitted in the hospital. And towards the end we understand that she started showing some recovery signs, and she started to walk with help of her daughter. And 12th November she is doing well, and she just complained some nominal back pain. And around 15 November she was discharged from the hospital. And on behalf of her daughter, she lives with her daughter, is said in the social background, she is a widow, and she lives with her daughter Katie, and the doctor wants someone to come to their home for Catherine Tracy's personal care assistance. So this is what we understand from this case note. You can read by yourself. This is a case note, it's been displayed, and towards once we look at the writing task, we understand from the case note you should gather the information, and you are writing the letter to Kenzie Jada, the head nurse in the Royal Perth Nursing Agency. You are requesting a nurse from the nursing agency to send to patient's house for personal help which would help in her recovery. So this is what the writing task. From the writing task we get the address to whom we need to write, and the concerned person is Kenzie Jada, and what you need to write is request. The purpose is actually requesting a nurse for patient's recovery, patient's personal care, which would easily help her recovery. So this is what you need to you will understand from the case note. Now I have shown you the first one and a number of questions. So once we get that questions, Who am I writing to? From the case note, we understand that we are writing to Miss Kenzie Jada, a head nurse at Royal Perth Nursing Agency. So get the answer like this. Who am I writing to? Head nurse, nursing care agency. And next we understand what is the purpose and reason for writing the letter. The purpose of our writing is to request a nurse for the patient's speedy recovery. So the nurse simply won't make a speedy recovery. So it has been understood that the nurse is requested to help her in her personal case and everything. She is with backbone injury, so she may not be able to do the things by herself, and it's spinal cord injury. So she just starting recover. So recovery is in the process. So since the daughter is may not be with her always, or she may be walking, or she may be a small kid. It's not been said in the case not well, just a daughter only is said. So Catherine Tracy would get somebody's help to regain her health. So that's why daughter wants someone to come to hospital, their home. So here, what is the purpose and reason for writing the letter requesting a nurse? What information do they need to know? So, all the details from admission to discharge, till what are the reasons why the client was admitted, what are the treatment was given to the patient, presently what is the condition when he is discharging, and that's called primary details of the client, details from admission to discharge. So here the present history is prominent, and the next question is, what information do they not to know? Because here it is previous medical history we have written, because the case note doesn't provide most big social present past history, like she was admitted to the hospital due to high BP in 1992, blood sugar patient, she is a blood sugar patient for the past year, and this has nothing to do with her present condition as spinal cord injury. So even if you notify it, even if you don't notify, it's not a big mistake to be understood. And you can write the social history. She lives with her daughter. So you can just, if you want, you can just mention she's a high BP and blood sugar patient. So even if you don't mention that, it's okay, fine. So in that case, we understand that what information do they not know? So previous medical history. There is no such thing previous medical history as such. So what's the current status? She recovers from the spinal cord injury. So these are the 5 questions we discussed. You should understand the questions from the case note. You should gather this information. These are the questions, these are the answers that you should gather. So then you can easily construct sentences. So to whom you are writing? I'm writing to nursing care agency, I'm sure about it. And what is the purpose of your writing? Really, it means the content of the letter. Why do you write the letter? The reason of writing the letter, requesting the nurse for the assistance of the client. And the next one is, what information do they know, do they need to know, and the other one is no need to know. So that also we classified it like details from admission to discharge and current condition, as Catherine Tracy is recovering from the spinal cord injury. And this is what we gather, the organizing the data. We selected a lot of data from the case note. Selected data we organized, and organized data we make it in a sentence with a good construction. Let's see what is a possible writing of this case note. So we have started like 15th November 2009 as a date. We have well furnished here her address, Miss Kenzie Jada, head nurse, so and so, Royal Perth Nursing Agency. And we addressed her like, dear Miss Kenzie Jada. We refer Miss Catherine Tracy, the patient's name over here. Her date of birth is displayed here. It's taken from the case note as such. And this part is called introductory part of the layout. Once we write the letter, we get a layout, clear structure layout, and this part is a letter's introductory part, and this is not included in 180 to 200 words, and your assessment is being done from here, introduction to conclusion. And I would just read for you this letter. Like, this draft is to introduce Miss Catherine Tracy, a client who recovers from a spinal cord injury, as she requires a nurse at her home to help in personal care for her recovery. She is said to be discharged today. So this is clearly covers 4 points, which are the means the main medical issue. The main medical issue is as a spinal cord injury. Reason of writing. Reason of writing is as she requires a nurse at her home to help in personal care. The next one is the patient. Who is the patient? So it's already written in the first line, Miss Catherine Tracy. The next one to be included in the introduction is a discharge statement, whether she is discharged or going to discharge or whatever it is. So this is also said very clearly here, she is said to be discharged today. And this has been introduction, and we have done well here. And coming towards the body paragraph 1, and that's what we prominently included in the question, like what all the details they must, the purpose of letter we have already said, requesting the nurse. What information do they need to know? Details from admission to discharge. So details from admission to discharge is like this. Miss Tracy was admitted on 19th September 2009 due to a serious injury to the backbone. She experienced pain, severe stinging sensation, as well as difficulty in balance and walking. In addition, a loss of bowel and bladder control were noted. After 1 month, she started to walk with the help of her daughter. Currently, she is stable. However, she complains occasional back pain. So this paragraph clearly gives an idea that when she was admitted, with what are the symptoms, she came to the hospital and it was diagnosed as what? So it was diagnosed as backbone injury, and there are some associated problems like loss of movement, loss of bowel and bladder control, and the prognosis has been explained, like after a month she started to walk with the help of her daughter. And current situation, the last fifth question's answer was what is the current situation? Current situation, she is stable, but occasionally complains occasional back pain. And then going to the next paragraph, socially, Miss Tracy is a widow and lives with her daughter. She has the medical history of hypertension and she is diabetic. She is a diabetic for the past year. Okay, this is what we discussed. Like, is okay to include or not to include is fine. Coming towards the end, in this regard, the service of a nurse is requested from a provision to take care of the patient at her home, which would help to fasten her recovery. This is what our writing purpose, and this is being going to be here as a plan. A nurse is being requested from the provision to take care of the particular client at her home and to assist in her personal needs and provide care and make her better to in coming days, or which would help to fasten the recovery. And coming towards the end, the conclusion, we just thank the provision. The writer thank the provision that the service you provide would be highly appreciated, or the care you provide. And we just give a hint that contact back to me for any other clarification you require. Please do not hesitate to contact me for further clarifications. So this has been going to be a well organized letter for the Catherine Tracy's case note, and you are ending up with yours sincerely, Dana Nicola, registered nurse, Apollo Health Agency. So we get a good idea that it has been organized well. Introduction, from introduction to conclusion, all the details which is needed is being simply taken out from the case note and paraphrased in a very well way, and we have written a good letter. You can also be refer to this, which would help in your writing very better well. Thank you.